All right, it is Wednesday, December 9th, 2020. We want to welcome you all in to Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers out of the state of Arizona to help you better make the best decisions for your family. You know their health and their lifestyle best, and we're here to guide you through all of that. We do have some important numbers to talk about today, and also a little bit about the vaccine. Everyone's pretty hopeful as we are on the eve of what could be for Pfizer getting approval from the FDA. So some excitement starting to build and hopes starting to build around that. So we'll spend more time on that in just a moment. But in the meantime, Garrett, some tough news coming in the number of deaths that were reported in today, a very high number that we have not experienced here in Arizona in a couple of months.
Yes. So we have, as you can see by the numbers here, Arizona is now above 7,000 deaths today. We reported 108 deaths today. The ACDHS reported 108 deaths today, and all of those are fairly recent. That is the 7th highest death report that the ACDHS has put out. And as you said, Katie, we haven't seen one of these since about middle of August was the last time we had a death report this large. So it has been several months since that time. The case rank, 4,444 cases today. That is the 10th highest we've had. So we're still sort of, even though we're kind of numbing to these higher numbers as we see this 4,444, because it's in the top 10, but it's at number 10 at this point.
So we'll spend a little bit of time on plotting these deaths on the chart to sort of see where these deaths have come, because you're telling us that they have mostly come in the last 3 weeks, and we'll get to that in just a moment. But as we address this screen, if it's possible to highlight maybe a couple of the more populous counties to update us on how things look there too.
On Maricopa County, 25,990, 2,600 cases added today. 52 of the deaths came from Maricopa County's report. And that's pretty typical for Maricopa County to take the more than half of the share for everything. We look at Pima County, the next one, 721 cases today. 16 of the deaths came from Pima County report. And then Yuma County, which is back again at the top of the list as far as per capita numbers, 298 cases today, 5 of the deaths coming from that area. And then let's just go over to Coconino, the next highest, or I forgot Pinal, I'm sorry. 75 and 3. We'll go to Pinal County, 70 and 6. So you can see Coconino and Pinal are about the same. And we'll just take a quick look at the Navajo Nation counties, 103 cases and 5 deaths, and then 87 cases and 4 deaths. So you can see, obviously, the majority of the deaths reported today were coming from Maricopa County. What's going to be interesting to see, of course, is that how sustained these numbers are for the death reports. We usually get, we've sort of always on a Wednesday, we've had a higher death report, and then it sort of goes down. But again, we don't know what sort of patterns are going to be involved with these newer numbers that we're seeing.
Okay, so when we plot these in on the exact date of death, you're saying that most of these are coming within the last 3 weeks. Which is such sad news, as we've talked about, for those families, because to happen right in the holiday season, that these weren't farther back in the year. Not that any time it's easy to lose a loved one, but you really hate to see it during the holidays. It can be such a tough time. And for any of you who in the comments have experienced that, it is very sad. So
yeah, this is what the curve looks like, the epi curve for the deaths, and as the light blue number. The light blue lines are the lines that come from just recently added to the day, that were added today rather than, were already there. So you can see a lot of these deaths now are coming, way before way after the 7-day average stops. You can see several deaths being added all the way up to even only a couple days ago, which is actually quite, it's more common now, but it wasn't early on. To see this many deaths being, even if we had a high death report, it wasn't typical to see them being added this early into the curve, or this late into the curve. So now we're seeing that more often than not, and that's what's causing our 7-day average. This yellow line here, you can see it's starting to just be a consistent level. It's going up at a consistent direction, and that has a lot to do with them adding these deaths early now.
Yeah, any note or clue as to what's bringing about this efficiency in reporting those numbers in, or just maybe fewer cases that have to be investigated deeply?
That's a good question on as far as the efficiency of it. Yeah, it could be something that comes from the hospitals, and that the hospitals are, unfortunately more efficient at this now and getting the data over to the AZDHS. I would say that's probably the most likely scenario, because most of the deaths that do occur from COVID-19 occur in the hospitals, in the ICUs. And so, they've just been better about getting this data over to them. And I do know several weeks ago they did. I remember, actually, now that we're talking about this, back in September, I remember them saying that they were going to be doing these more of these, which used to be quite rare, these certificate surveillance. And I think now they do them pretty much daily. And so they're picking them up from the hospitals as well on a daily basis, rather than what it used to be, which they would be researching, and then we get this large number because they would do certificate surveillance, and it would go back 6 months, or not 6 months, 6 weeks, 7 weeks, 8 weeks, and now it's going back only 3 weeks.
Yeah, we'd see more of like a batching system where they would all happen at once and then be plotted in on those dates. Okay, so Garrett, one of the things I noticed today, there has been a percentage that we've tracked closely that ticked down just a bit today, and I'm wondering if you can help us better understand what things would factor into that, or if that's a number that is becoming more hopeful, or if our latest high reporting has affected that. So to explain, on Maricopa County's site, we have used that to track the number of hospitalizations. So a lot of times when people will say, 10,000 cases reported in, I don't care about cases, all my friends have recovered, or something like that. The concern then becomes that a certain percentage, no matter what, in the history of the pandemic, arrives at the hospital. We've seen that around 8% to 11%. Today, it actually went down to 7%. Is that because of higher numbers that have been reported in, or are we getting better at treating them? Do we know what the cause is? Either way, it's hopeful news.
That's a great question, and it could be a combination of both, but it is really the biggest variable, or the biggest factor that's going to drive that number down, is the number of cases that are coming from this age group right here, the 0 to 19 and 20 to 44, because this age group does not require that much hospitalization. And so as these case numbers go up, you can see just right here, 1,500 of the cases added in Maricopa County came from this age group. That age group, obviously, as we add more cases and more cases in that age group, it's going to push this hospitalization number down slightly, simply because it's the chances that people in that age group will require hospitalization is very small. And so really it's this number right here with a little bit of this number, this 395 in the 65 plus category, as well as the 743 in the 45 to 64, that's where hospitalizations are going to come from.
So the age group could sort of be a leading indicator when you're looking at age group and cases, as to then how many show up at the hospital. So that's an important place to look for this. We use Maricopa County numbers just because they're very easy to read on their site, and it's the most populous county in Arizona. But this is a pretty good indicator of how things look across the state. So hopefully 7% stays that way, or even goes lower. That's much better news, especially when our hospitals are slammed, and they are indeed busy, Garrett. We had reports in from one hospital today, Valleywise, saying that they have one staffed bed left in the ICU. They have other beds. They're not staffed at this point. They have one staffed bed left. And that is obviously just one healthcare provider here in Arizona. And our numbers look at the entire state. They don't break it down by provider. But how do things look for us right now?
So I have I actually have a new dashboard I'm going to share with you. I'll see if I can zoom it in a little bit. This actually comes not from the AZDHS, but from the White House Coronavirus Task Force numbers. There is a colleague, a medical doctor actually, that is a stats expert that puts this out on Twitter. I picked up the link from him. I'm trying to get his information for producer Carrie. He is Data Driven MD at Data Driven MD, and that is this person. And what this does is basically, this is our hospitalization data. But what it does is it also gives us to the hospital, which is something we don't typically have, and we don't see in the AZDHS numbers. The numbers are not as up to date, as we're only going as far as the week of December 3rd, which is going to be last Thursday. That was the last time this was updated. So it's not as updated as the ones we have. However, it gives you a good idea what's going on at the hospitals themselves. You can see, for example, Banner Desert 154 occupied overnight beds with COVID-19. About 18.2% of the beds are occupied. The staffed beds, very important, are occupied by COVID-19 patients, and they have available ICU beds 29, and they have about 178 total available beds left. And this goes down. You can see almost all of this is sorted right now by the size of the occupied overnight beds. See, almost all of them are Banner, Banner in Maricopa County, and then Banner in Yuma Regional. No, excuse me, that's not a Banner hospital, but Yuma Regional right there, another Banner, St. Joseph's Medical Center, and they just go down from here, and it really shows you, what the total occupancy we have. We have available ICU beds right now, staffed only, about 782 throughout the entire system. That's what this says right here. We have other data that sort of they're all available ICU beds, and that's what we have. So that's about what we have in staffed right now. So let's look at the AZDHS numbers as well, just to compare them both. I'm going to pull this off. I'm going to go back to the.
That's such a helpful tool, though, Garrett, as you're pulling up the other page, because it helps illustrate. I would be looking at that more in the rural areas to see what's available in my city, and that's not just for situations with COVID, but if my kids are hurt or a family member's hurt or there's a car crash, do they have enough places to put people and provide that care?
Yes, and see, this is like sort of where we have to reconcile some of this data, and I'll do some more work with the White House Task Force to figure it out, because obviously that one said 782 beds available, staffed ICU beds. That's probably not accurate. We only have about 178 or so, and this is what our numbers look like right here. 10% is that's our headroom right now. 10%, about 180 beds, and about 44% of the ICU beds are taken up by COVID-19 patients. When we go to inpatient, we see a similar situation, about 38% with a headroom of about 10% as well. Basically, this one, of course, this headroom we're having in the inpatient, this is sort of where record lows for inpatient headroom. That's something to consider.
So Garrett, if that the White House information that came out, it was December 3rd. That's the most recent data that they got. If their data is outdated a little bit, it might get a little closer to that number.
Yeah, absolutely. If we look down at where December 3rd was, we can see numbers are a little bit different. Right. So I'll do a little work on that to make sure I get some real good information for you tomorrow. I was just past the map today, or the dashboard today, so I haven't had a chance to really digest it as much as I should. But as we go through these, where were we? Emergency room departments, you can see emergency room beds up to about 52%. When we go to hospital metrics, we're just going to go to discharge. You can see our discharges are higher than they were in the summer. You can see 734 COVID-19 discharges. Emergency room departments, second highest emergency room visits today for the pandemic.
That was a bump today, Garrett. Look how low it was yesterday and how much it bumped up.
Yeah, this is a very interesting metric, and that's why it's one that we like to watch, because obviously it's a leading indicator. But it had been down for several days now, and so I was kind of flagging it as, okay, what's going to happen with this number? And then it popped up again, and now it's the third highest it's ever been. I thought it was second, but there's this on July 8th there was 1980. This is 1978, so 2 less than that one. So it's the third highest. We just have to keep watching this. It is continuing on an upward trajectory. If these numbers that come next are a little higher, then obviously the trend line is still going up. So that's something we don't want to see. Obviously, we want to see these numbers especially go down, because it's a leading indicator of, say, we'll start seeing some pressure on the hospitalizations starting to be relieved possibly, and we're just not seeing that.
Or the concern is some of those discharges then were people arriving back at the ER. I've talked about a friend of mine who was sick, who went into the hospital 3 separate occasions, and a young, seemingly healthy gal, and to show up there 3 times counts in those numbers.
Yes,
okay.
Exactly. The numbers that we show right there, those numbers can be readmittances. So I did get this from the AZDHS on the hospitalization dashboard. Let me just go back really quick, and we'll just clarify this. When we go to the actual hospitalization dashboard, which is this dashboard, there's no readmittances in this dashboard. It is just the most recent. So if someone goes to the hospital and goes back, they'll only accept the most recent as the number. So this is to the person. But these numbers, because they're self-reported bed counts, this obviously will also have readmittances in there, or if someone moved from inpatient to ICU, all of that is going to be taken into consideration in this.
Yeah. Okay, Brant's asking, why won't you answer the questions? I'm going to be very honest. I've been turning off the comments a lot lately to protect my own personal mental health and just to provide good information for you and not have to deal with some of the harassing comments that are coming on here. So I will take some time, Brant.
I did. So he was asking, Brent was asking about Banner Baywood.
Okay.
And Banner Baywood was occupied 134 with a 33.3% COVID-19 staffed bed. That's what the patient numbers are.
So say that one more time. What was the number for Brant?
It was 134 occupied overnight beds with COVID-19 patients, and then the percentage of staffed beds occupied by COVID-19 patients is 33.3%. They have about 11 ICU left. At least that's at the last check. These numbers are going to move really fast right now, so I would look at these numbers as outdated as far as the availability of these numbers.
Yeah, 1 week old already. And then Sarah is asking, is that White House report publicly available? It would only be through the Twitter account that you gave at this point.
For her? This data is available. It's just a dashboard the person put together. But this is something that this is all data that is publicly available. This is through the Health and Human Services. Everything on here is stuff that is published on a daily or whatever the basis, the interval they're published on. All of this is publicly available. So
for Sarah to have to dig, that might be a lot of digging, and that account, that Twitter account does put that in a dashboard, and that was data-driven. There it is. Thank you, Producer Carrie. Data-driven MD. So if you want to check that out, Sarah.
I do apologize. I can't really there's no search function on this. I know people are asking about different facilities, but since I can't search, like just type in a facility and move on.
Oh, and scroll through it. Yeah,
so it's going to be hard for me to like check everyone's facilities. I'm looking at for Del Webb right now, and I'm not even seeing it right now. So you just have to go to that Twitter account and check out it, and you can find it yourself. Again, I do apologize, but it's just not. It's a great dashboard, but it's not searchable. So I can't just go through and do all these hospitals. So I do apologize.
Yeah. No worries. Oh, and thank you all. So many nice comments coming in.
Micah on the comments is putting up a link that is in fact the dashboard link. So thank you.
Awesome, Micah.
Coders Against COVID. That is the dashboard link right there, the easy one. I had one that's just it's a datastudio.google link, and it's crazy, but that will get you the same place.
Perfect. Micah, thank you. Thanks for joining us again on here too. Kevin's asking, what's the delivery of the vaccine going to look like? Okay, so I'm going to try to keep this more Arizona specific, keep you updated on this. Obviously, tomorrow's the big day that everybody's hoping for, that Pfizer will receive the FDA approval. So we will track that for you, as we always do. For most of us, Kevin, and really good question, for most of us in Arizona, it's not going to be until the spring that we're able to get a shot. The first American who gets a shot is likely to be happening on Friday. That is the target time frame, and of course, it'll be just like everything you saw in the UK. We'll, I'm sure, have video of it and tell you everything about that specific person, and it's going to be a benchmark moment here in the United States. The concern in all of this is that 2.9 million doses are going to be headed out. Not nearly as many as they were hopeful for. That's got to be divided into states and then into counties and so on and so forth. So here's the deal. Of those 209 million doses in Arizona, we are expecting 383,000 to show up here in December. Once again, 383,000 doses. Now remember, this is 2 doses that somebody needs, and I'll get to more on that in just a moment. A December 13th arrival is what they are hopeful for, and at that point, they're expecting 47,000 doses to go to Maricopa County and 11,000 doses to go to Pima County. Then, in week 2, they would be sent out to all 15 counties, 4 tribes, and the CDC pharmacy partnership that we have. So that's kind of how that looks. Now, everybody's saying 2 doses. Okay, was there a consideration in giving everybody, this is so fascinating, Garrett, giving everybody 1 dose? And moving on with it. Remember, we got to get 2. And you do get to some level of immunity with 1 dose. That would be 52%. That second dose is what gets you to 95%. That was a discussion by the White House task force. And ultimately they said, you know what, let's just get to the people who need it most, get them both doses and move on. So that was the decision made a while ago as they were thinking about how to get this thing going. Let's talk about these 2 people that had allergies in the UK. Really big concern. 2 people had allergic reactions. That is expected when you move from testing thousands of people onto millions of people, which is what we are, the focus is there in the UK right now. So for people who have severe allergies, they're going to have them hold back just a little bit. That's people who are severely allergic to some type of food, medicine, or vaccine. Let me say that again. Somebody who is severely allergic to a certain type of food, medicine, or vaccine. They're going to say, wait just a minute, let's see what's going on with this. But that is not unexpected, Garrett. That is part of sending this out to a broader community and understanding this vaccine a little bit better. So hopeful news coming tomorrow that hopefully it will get approval, and they'll have everything they need to say that this is going to be safe. So yeah. Oh, Kevin's writing. Awesome. Thank you for that Arizona specific answer. You are so welcome. So that's kind of how the numbers break down week 1, week 2. Beyond that, we'll learn a little bit more and learn more about how many doses are coming to which people. Obviously, we're not getting as many as we thought we would, Garrett. We don't nearly have enough with those 47,000 and 11,000 and even the 383,000 to split those into dosages to get everybody in that group 1A vaccinated. Right. But this is a start, and we're getting closer, and we got to take the wins where we can get them, because this has been a long time coming. So that's where things stand for that. All right. So let's get back to some of the numbers, and I'll get to more of the questions in just a little bit. How does the R0 look today? How does the transmission look here in Arizona? And as you pull that up, the White House also saying that Arizona is not doing enough to warn people about how to prepare for the holidays, what to do to distance, and all of that. The mitigation efforts coming out of the White House, they're saying, are not enough here in Arizona. And so as we look at that spread, how does the number look for us?
I'm going to look at, I'm going to reference RT.live because we always use RT.live, and it's 1.09. But I am going to talk about the COVID Act Now RT right now because I want to go through county by county. You can see the estimate for COVID Now, Act Now, has us at a 1.2. And when we look at this, I'm going to put in this view all the counties here, just so we can see what all the counties look like here. And I'll sort this from the highest to the lowest. Mojave County is considered to have the highest infection transmission rate at 1.27, followed by Yuma at 1.23, Santa Cruz by 1.2. In fact, Cochise, Pima, Maricopa, Pinal County, Yavapai County all have over a 1.2 transmission rate reported on this. And then we go down, we go to Yavapai County also does. Navajo County at 1.19. Apache County, we actually go down. We actually have a couple counties that are in the transmission rates in which they believe that the infection is slowing, and that's Apache, Greenlee, and Graham County. All of those under 1 right now at a 0.98 for Apache, Greenlee 0.92, and Graham County 0.87 at this point.
And those numbers fluctuate daily, Garrett, or how often do they recalculate this?
They will. I believe that these do fluctuate daily, these COVID Act Now ones. They use a slightly different estimate than RT.Now, and that's why it's a little different, but these are calculated on a daily basis, yes.
And what about that ICU headroom used for that pull-down bar 3 over? That's an interesting look at ranking the counties county by county and how that goes.
We do have one county we have three. Wow. 3 counties that are considered at right now 100% of their headroom being used. Navajo, Pinal, and Gila County are all estimated at 100%.
And I'm curious how Pima looks. It looks like we have to scroll down just a bit. They were saying that now we're looking at ICU specific here, but that their hospitals overall, especially in Pima County, are strained. They just put out an alert saying they're pretty concerned. This number is a little misleading again because that's only ICU specific and not the.
Yeah. Yes. And it does say Pima County does. This one does. Now again, this might be an estimate because this data has to come from somewhere, but it doesn't come from the ACDHS because we already know what the ACDHS reports, and so we know that this can't be this. This is probably from the HHS, which is that data we just looked at from that data-driven that studio, that hospitalization dashboard we just look like. So this is probably from that, and so this data will be slightly older than some of the other data that they're using, which is these infection rates and cases per 100 and whatnot.
Okay. So Kelly's asking, so if a frontline worker gets the vaccine first, what about their spouse? When do they get one? So they have broken down the categories. It would depend on your spouse's age, if they are over 65, if there's any comorbidities involved, things like that. If they are not, they're going to be lower down on the list, right there with most Americans, which is late spring, early summer. So that range right in there. Really good question. But if one of those things bumps them up in a category, then that's going to make it a different situation. So.
Connie Wheeler Connie Wheeler is asking, what is the R0? The R0, just to make a point here, since this is a numbers show, the R0 is an estimate that is only done at the very beginning of any pandemic. So there is no R0 in that sense. There is no R0. It no longer is of any relevance. We are only looking at what's called the RT, the rate of transmission over time. And that's one of the reasons, that's one of the big differences from back when we were in February, when everyone was putting out an R0 that was in the 3s and the 4s, because that was a straight estimate of where they thought the R was going to be. Now we actually have data to feed this thing, and that's why they've got these estimates. And when we look at these, for example, I will go to rt.live to show this, because this is the best way to show what they mean by the RT versus the R0. So when we look at the RT, I'm going to click on Arizona right here. So this entire graph is the RT. All we're giving you is what it assumes is the most recent estimate, which is 1.09. But this whole thing is the RT. There is no R0 anymore. So just so everyone knows, that's how that works.
Yeah, really important distinction. Good question too.
Yeah, very good question. One of those things just helps people understand what we're looking at. Yeah.
Yeah. Prapel's asking, today is 33%. Is this still, it looks like there's a misspelling, data something, or a reporting issue? Should we take that data seriously? I think, is he asking about the percent positive?
If he's talking about the positivity rate.
So one of the things that's been confusing for people, we touched on this a little bit yesterday, is when you take that number of cases and then you divide the number of positives into it, it's giving a crazy number, like 60%, or perhaps I didn't do today's, but 30%. So it's got a few more steps involved, and you do the calculations for us on Twitter.
So, because I don't use it for anything, so I don't even track it. I know it's such a simple calculation, but it's so misleading that it's not worth tracking. So I don't.
Yeah. So the percent that you break down, Garrett, you do it not only statewide, but then county by county for us on your Twitter account each morning. What's a better percentage for that, or a more accurate percentage?
18.6 is where we're probably at, about almost 19%. So we can see, and what I do, just so everyone knows what this methodology is I take today's epi curve and yesterday's epi curve, and I simply subtract them from today from yesterday. I take the most recent 7 days, and then I do that for cases and tests, and that's when I do that calculation, the cases versus tests. And that's where I come up with that 18.6. That takes care of any noise that happens after the 7 days and anything else that's more of an administrative correction. We're looking at just data that's been done for the last 7 days. So anyway, now that I've talked about that, the La Paz County, 60%.
Oh,
now, that looks ridiculous. But just to let me figure out really quick. It took me 2 seconds to do this. I'll show you how many cases that are tests they did, which is likely very low.
So you're saying because fewer people live there, then that would affect the number so much more.
They have a 60% positivity rate, but they only did 10 tests. So just that kind of stuff does happen in the lower counties, or the smaller counties. So anyway, because you can see Greenlee is at 0. So it's the same thing. Greenlee will pop from 0 to 50, and La Paz does the same thing. These are very small counties, so they'll go from 0 to 60.
Well, you have one family test positive, and it could sway the whole numbers.
And it goes up to 60%, exactly. Mojave County, 16, excuse me. Navajo County is in the 30s. And then we have a couple 20s here in Yuma, Yavapai, and Santa Cruz. Pinal, 23%. Pima, 17.5%. Maricopa County at 19.2%. We actually have some low ones here at Coconino, 12.8%, low for us now. And then Gila at 6.1%. But as you can see, we're sort of in a range now where we're seeing positivity rates in the high single digits, all the way to the to 30% or so.
Yeah. Okay, so Garrett, we do have some developing news, breaking news, just coming into the ABC 15 newsroom that I want to keep you updated on. We talked about this situation in Pima County, and they are writing in to tell us that all county hospitals have now implemented their surge plans. They have halted elective surgeries, so that's happening right now as we're here with you. So no more elective surgeries happening in Pima County. Let me say that once again. For Pima County, all county hospitals have now implemented their surge plans and have halted elective procedures. So if people are having to get something done, whether they're brought to another county or another hospital to get that done, but for Pima County, that is not going to be happening. So that update just coming in. And Katie's writing, thank you, Garrett. We can go to all these sites, but explaining what they mean is what we all need. Thanks to ABC 15 for having a numbers person. Katie, we not only have the same name, but the same sentiments. I'm so thankful that we have someone like Garrett on our staff to help us better understand all this. So send the email to my boss. Let's thank him. All right. So Garrett, what other numbers are you watching closely today? I know there were a few things that came in that we were watching closely. And as I ask that, I always highlight the top 5 states, and we were in the top 5, obviously, because it comes in over the last 24-hour calculations, and we had that 12,000 number. But here are the states for you: Ohio, California, Texas, Arizona, and Pennsylvania. So those are the states to watch right now. So back to you, Garrett. What sort of caught your eye today?
Well, I'm actually going to talk really quick about what could happen tomorrow. There was a blog post on APHS today that talked about how they made changes to how they calculated the zip codes and how they took in the data for the zip codes. There was too many. They said there were too many cases that were still in the system that were basically tied to the laboratory or to the testing facility rather than the case itself. And so they made a pretty large recalculation of the entire zip code map. And what we need to understand is that could very well potentially impact the Maricopa County Schools dashboard that we look at every single day, or every single Thursday, excuse me, every week. And we're scheduled to look at that tomorrow. And I really don't know how different it's going to be, and I don't even know how relevant a lot of it's going to be. But we just have to understand that when we look at the data tomorrow, it could be there could be some significant differences because all of this data has changed now from the very beginning. So it's not like all these things have just been reset to today. So like, oh well, it's changed today, so no big deal. They shifted those cases that were supposed to be, like, for example, 85009. I used to talk about 85009 a lot. It used to have 7,000 cases. Today it only has 4,600 cases.
Wow.
That's because a lot and we never knew. In fact, I believe we even did a story about this, about 85009, because we always assumed that it was the correctional facility that was causing the cases to go up. But what it seemed to be was that there's a laboratory. One of the major labs is in 85009, and all these case numbers were still being assigned a zip code to that 85009. And so when they reassigned them out, it dropped that about 2,000 cases. And that's going to could impact Maricopa County's numbers.
Yeah. So Garrett, it wouldn't affect the overall total. It would just affect where those numbers end up. Okay.
Right. Yeah, nothing. The overall totals in all the counties are exactly the same. It's just that when we look at things at a jurisdictional level, like what we're going to look at with Maricopa County tomorrow, right, it could throw a lot of stuff.
Distribute that.
Right. It could be completely different than what we've been used to. And we'll just have to watch to see what happens tomorrow. I don't think it's going to change much as far as the coloring. I don't think we're going to see a lot of zip codes going down into the moderate category. That just doesn't seem to be very likely at this point. I think it's going to change around some of those numbers, and maybe some of the numbers for the zip code or for the high schools and unified schools and whatnot. But yeah, I don't think we're going to see this like change where like, oh, look, the East Valley really wasn't as bad. I don't think we're going to see that.
Well, and at this point, so many of the schools are now at home, and they'll be staying that way for the next 2 weeks, because it would be almost silly to bring everybody back in just to leave again in a matter of 10 to 14 class days. Okay, so Jenny's asking, what do you expect the COVID-like illness number to be tomorrow? That is something that we would actually have earlier because it comes out on Sunday, right, Garrett?
It does. In fact, let me see if I can give you that plot. I actually can give you that plot early, at least see where it is right now. And this, because Maricopa County actually does publish their CLI
Earlier.
of the state.
Yeah.
It takes a while to load because I don't know why, it just takes a while to load. But as soon as it loads, I'll let you know what that is.
Okay, so for a frame of reference, it was at 7.7 last week,
Yes.
and we've seen it climb steadily for the past few weeks. The reason so many people ask about that is that 10% threshold that was such a marker for schools. Now, many of the schools that have stayed open are sort of using their own in-house metrics that are based on how many actual student on an actual campus get sick. For instance, in Chandler, they're using like a percentage point of illnesses within that school. So they're not looking at community spread there, but still an important marker.
So I'm looking at their information here in Maricopa County. It does say the most recent information they have is that 7.7 total on November 28th is the most recent one they have, which is not last Saturday, but the prior Saturday. They do have for the current week at a 6.3, but you can see all of these data points do tend to drop down. So what I would say is it's very likely it's going to go up. When they recalculate this curve, it's going to go up. But it's, of course, the question is how much more is it going to go up? Is it going to go up? It doesn't look like it's going to go up into the 10-point range at this point. It might be another couple weeks where we're observing this to see where it goes. But it looks like it's probably going to be in the middle 8s tomorrow.
Yeah. And Jenny and I shared a wavelength. She says, thank you. Yep. Just wondering if it hit 10. So that's what we'll be tracking, and we'll for sure let you know that number tomorrow, Jenny. Thank you for the question. Annie writes about retests. How many of the positives are retests? So all the tests are deduplicated, which we didn't know that early on in the pandemic, and we pushed for answers on that, and we were happy to let you know that they do deduplicate those tests so that
we can actually tell you now. We can tell you how many are retests essentially. Because they added a new dashboard. So today, 12,000 tests were completed on individuals. So 12,000 tests completed on individuals, but the test conducted today was 27,000. So there were that's the number of duplicate, like basically the duplication. And that's not a duplication on one person. It could be anyone that has already tested at some point in this pandemic. But about 27,000 or so tests were released or processed yesterday. But only.
So are you saying 15? Which number is the new number? Like people who have tested for the first time? Is that the 15,000, the 12,000?
Not people. Yes, that's actually a good point. Yes, it probably would be people that tested new for the first time. If I had to make a guess on how this data is working, it is new entrances into the system, and that's about 12,091 tests that were conducted on those people. For people who have already been in the system and had a test, it's now 27,603.
Yeah.
And that's obviously going to be like situations like, in healthcare facilities and other facilities where you're constantly exposed to COVID-19, where you have to continually test, whether it's the saliva test or the PCR test. That's really what you'll see in that duplicate. There's going to be people who are sort of a high risk professional activity and do have to test a lot.
Yeah, because Betsy's asking how often should you test? That would be different for every person. Like, for instance,
yeah, exactly.
If you're feeling sick, obviously go get tested. If you have had exposure to someone who is positive, so that's for some of the reason, not to talk out of school here, Gary, you've talked about it before, but that's why you went and got tested from exposure from someone else, and thankfully testing negative. Same in my case, I didn't feel well in July, went and got tested. Recently got tested again for exposure. So that's kind of how the system works. When we have enough tests, you're lucky enough to be able to go get tested here in Arizona. There's not a strain on the system that we saw in other points in this pandemic and in other places around the country. So Betsy, if you're interested in getting a test, and I'm saying this for anybody on here who doesn't know where to get a test, because I'm finding out more and more people don't. We can put up the link that we've been using to give you. Just go to azhealth.gov and then /COVID-19 testing. I always talk about there's the saliva test, there's the nasal test, several different ways, and you'll find those there. Every single day there's a testing site, so that won't be a holdup at all. In fact, the saliva test just goes to different points all over the state, so you're able to go get one that's closest to you if you need one. So if there's any other questions about testing, we're happy to keep you updated on that. Let's see. Shiden's asking, I hope I'm pronouncing your name right. Was there an error in tests reported by ADHS today? Maricopa total tests being greater than statewide total
Good
tests?
question, and the answer is no. Let's look at that really quick. I wouldn't call it an error. Error's not the way of putting it. So we look at, say, the number. Yes, I see what you're saying. Number of new tests reported in Maricopa County is 12,362, and the number of tests everywhere else is 12,091. That could be. Let me just explain what that could be. That could be. No, I will say it could be an error. It could be that they're trying to work out how to put that total test number out there, and they probably have it on one that reports into the dashboard, and it's not on everywhere. So I'll reach out to them to see if that's the case. But the other thing that it could be is there are times in which those numbers do not match with Maricopa County and the rest of the state, simply because they sort of have this holding area in which it's reported, but it's not put into the statewide number sometimes. It just depends on when each of the data is pulled by either the county health department or the ASDHS. It could be one of those two things. I'll get back to you and see what that is.
Could it also be, Garrett, then with that number of tests and retests? I mean, if you have more retests,
it could be. So since they have this new dashboard, they could be trying to put that retest number out there too. This could absolutely be a coding error in that respect. I didn't catch that this morning because I don't actually click through these. I just pick up the total and move on. So thank you for catching that. I will check with them to see if that's the total test number, that test and retest number, or if that's a singular test number.
Yeah. So Shiden, I hope that answered your question. I hope we can get an answer for you. And I hope I'm pronouncing your name right also. Thank you for the thoughtful question on there and their writing. Thank you. And we just have time for just a few more things. Gilbert is writing, why isn't there any talk about healthy eating, like no fast food and processed foods? And that is out there. You should talk to your doctor about that. Garrett and I are not doctors. We're just people who love numbers and love talking numbers, no matter the subject. And unfortunately, a pandemic is hit, so we're focusing numbers in coronavirus, but we love to talk numbers about anything. So that's the short answer. So please talk to your doctor about that, and you can get more information on that front. All right, that's going to wrap it up for us right now, Garrett. Tomorrow is going to be a very exciting day. It seems that this thing will pass. It is expected that Pfizer will get approval. So there will be much to discuss tomorrow. Again, the first vaccinations here in the United States. Of course, outside of the trials, we know people have been in the clinical trials, and we are so grateful for their bravery and their sacrifice in order to get us to this point. But Friday should be the first time we see an American outside of the tests getting that shot. So we will have that for you. We'll be covering it all, and a deeper dive at the numbers happening tomorrow. Tomorrow's a big day because the zip codes come out, as we talked about, and the schools, and we will have all that. So have your typing fingers ready in the comments, because we'll take all your zip codes halfway through our discussion and get you all the very latest numbers as it pertains to your specific neighborhood, so that you can make the best choices for your family. Want to let you know where to find us. You see Garrett's Twitter account right there. Some really good updates that come in the morning at Garrett_Archer. Mine is at Katie Rammel, and so many of you are watching on Facebook if that's your preferred method. My account is facebook.com/news from Katie. All of our very latest reporting is coming up for you at 4, 5, 6. Oh, it's already past 4. It's already starting now. If you want to turn on the TV, it's already on. It's 4. 4:01. All right, there you go. So I don't have to do it, so that's why I'm still here with you. 4 o'clock, 5 o'clock, 6, 9, and 10. Our very latest reporting can also be found if you miss it on abc15.com/coronavirus. Thanks to all of you. We're seeing all your sweet comments there, and that's why we do it each day, just to help you make the best choices for your family as it pertains to these numbers. Thank you, Margaret. You're welcome. Take care of that little one. All right, we will see you tomorrow, same time.